How do GLP-1 drugs affect your brain health? Imagine a medication that not only helps control blood sugar but also supports your brain's health and function. That might sound surprising, but it is exactly what some drugs called GLP-1 receptor agonists can do. These medications were created to help people with type 2 diabetes manage their blood sugar levels. But recent studies show they do much more than that. They influence how your brain works in several important ways. GLP-1 drugs target the brain's reward system, which is responsible for feelings of pleasure and motivation. They affect the releases of dopamine, the chemical that makes you feel good when you eat something tasty or accomplish a goal. When taking these medications, many people notice a decrease in food cravings and less food noise in their minds. This is because the drugs act on parts of the brain that control impulse and reward, helping to regulate appetite beyond just feeling full. These drugs also seem to protect your brain from cognitive decline. Research suggests they lower inflammation in the brain and improve how the brain uses insulin, which is vital for brain health. They promote the growth of new neurons, which is called neurogenesis. A large study involving over 2 million veterans with diabetes found that those taking GLP-1 receptor agonists had about a 10 to 20% lower risk of developing dementia or Alzheimer's disease. GLP-1 medications work through multiple pathways inside the brain. They influence signals like Krebs, pi 3 degrees Kelvin AKT, mTOR, and SIRT1, which are involved in neuron health, plasticity, and reducing cell death. They also improve blood vessel health in the brain, reducing inflammation and oxidative stress in tiny blood vessels that supply the brain with oxygen and nutrients. This helps keep the brain's blood flow steady and healthy. Beyond cognition, these drugs can also benefit mental health. People taking GLP-1 drugs often see a lower risk of seizures, suicidal thoughts, and even disorders like schizophrenia. They may also reduce the risk of substance addiction, including alcohol and opioids, likely because they influence the brain's reward pathways and decrease overall inflammation. Research shows that proper GLP-1 receptor function is essential for memory and learning. When these receptors are missing or not working, animals show problems with memory and brain plasticity. This highlights how important maintaining healthy GLP-1 signaling is for keeping your brain sharp. For people with diabetes, these brain benefits add to the reasons to consider GLP-1 receptor agonists as part of their treatment. Since diabetes itself can increase the risk of cognitive problems, using these drugs might help protect the brain while managing blood sugar. They work best when combined with lifestyle changes and other medications. Ongoing studies like the EVOKE and EVOKE Plus trials are looking at how well these drugs can prevent or slow down diseases like Alzheimer's. Future research might even find ways to combine GLP-1 drugs with other therapies for even better brain protection. All in all, GLP-1 receptor agonists are showing promise not just for blood sugar control but also for supporting brain health and possibly reducing the risk of cognitive decline. They are a fascinating example of how a medication can have multiple benefits that reach beyond its original purpose.